Dr. Fogarty taught us how to incorporate your whole team into taking care of the patient.
One of the essential ingredients of the program is to bring together providers and staff from different practices in an environment where they can be comfortable and work together and learn from each other. We've tried to make things geographically centered. The Finger Lakes PPS covers a 13-county region around Monroe County, 12 surrounding counties down to the southern tier. Many of these practices are located in rural areas, and it's difficult for them to drive very far for very long. So we try to bring people together on a sort of a geographic basis.
The Practice Transformation Fellowship is looking at change within your practice and how to look at normal, everyday situations that you deal with, and analyzing those processes and looking at ways to improve those processes, or even come up with new processes, or looking at problems that may be occurring and how to fix them.
By learning how to use the entire team, how to use properly medical assistants, nurses, front-end secretaries, in order to share the documentation, share the paperwork, and the like, it has really, for many physicians, transformed their practices.
So now, after having gone through this fellowship, instead of my checking my diabetic patient's feet for neuropathy, I have a nurse that'll do that. Instead of myself trying to get all the information from the patient.
They teach us the PDSA type of reporting, which stands for Plan, Do, Study, and Act. So the PDSA. And they're really little short-term projects to improve the quality within your office, maybe on just a small issue, maybe a larger issue.
Until a few years ago, virtually all of the income that physicians made were for fee-for-service. So that meaning that they got paid for each visit that they saw the patient for and whatever ancillary tests that they get. Now we're moving to a value-based payment, which is where you get paid for the outcomes that you do, and there'll probably be a little bit of fee-for-service with that. And we're only about a quarter of the way there, but already that means that a significant amount of income that practices make are from the outcomes.
We've done very well, in large part because of the fellowship, the things we learned. We've met almost all of our goals over this last year since the fellowship as far as value-based payments.
The U.S. healthcare system has set for itself a goal that's called the triple aim, which is better healthcare, better patient experience at lower cost. And more recently, what's been added to that is better experience for the healthcare providers, the wellness, the well-being of those who provide care. Because the recognition is you can't reach the goals of improving health outcomes and improving the well-being of patients unless you address the well-being of the healthcare workers. And primary care clinicians are number one on that list that needs to be addressed.
Colleen is a terrific facilitator. She's a doctor herself. She's been in the trenches for many years working with the safety net population. She knows what she's talking about, and her facilitation skills are just excellent. Everyone should learn from Colleen.